Senior Connections is one of 633 area agencies on aging in the United States and one of 25 in Virginia. We've undergone significant transformations in our 50-year history and are delighted to share our story thus far with you. Empowering seniors to live with dignity and choice. That's our mission.
My name's Larry Lyons. I represent Powhatan County on the Board of Directors. I'd say that the main work of Senior Connections is to improve the health and well-being of the senior population, both in the city and out in the outlying jurisdictions. Not all of those needs are the same, as evidenced by our more than 20 different programs that we offer. One of the real reasons for the agency was to help people stay in their homes longer. They do that by sharing information both with the individuals and with the caregivers for those individuals. In 1992, the agency moved into its current facility off Cary Street in downtown Richmond.
My name is Willis Fun, and now I'm a member of the Long Range Planning Committee, and also recently I've become part of the Finance Committee. Senior Connections is grassroots. In other words, the needs originates in the community. The policies really determine which way you're going in the future, and how it affects the community. Volunteers, community partners, staff are the heart of Senior Connections, and I want to emphasize that the advisory board members and also the board of director members are volunteers, because we are non-paid, but we get our enjoyment or reward from just helping the community.
My name is Marge Boynton, and I'm Director of Support and Advocacy Services for Senior Connections. I've worked at the agency for 30 years now. Senior Connections has an area plan for aging services. It's a planning document that we do every 4 years with yearly updates. There's a number of factors we take into account when we're doing the area plan. We certainly use demographics. We use unmet needs reports that we get through our database. We also use customer satisfaction surveys from our clients. We also have community discussion groups in our various localities that brings together older adults, caregivers, community representatives to get their input on what we're planning. We usually have a presentation and then go through a guided discussion, questions, so that we can get their input. Last year, we served 4,200 unduplicated individuals through our area plan services. Some of the individuals, of course, receive more than one service, and we're talking about our core services such as information and referral, case management, the meals programs, our congregate cafes and our home-delivered meals programs, our employment programs, money management. So the 4,200 are the individuals served through those programs. But in addition, through our social media, through our agency newsletter, and presentations in the community, we're serving at least 20,000 other individuals.
I am Missi Boyer. I'm the Director of Nutrition and Wellness at Senior Connections. I oversee our home delivered meals program, friendship cafes, and health and wellness programming. I have been with the agency for over 13 years. With our Older American Act funds, in partnership with Fee More and volunteers, we are able to provide over 750 adults with meals each week. The meals provided are nutritious and provide daily contact with caring volunteers. We also have 20 friendship cafes, which are our congregate nutrition sites that provide over 600 individuals with hot meals, activities, and socialization opportunities.
Hello, my name is Patrick Hickey. I'm the No Wrong Doors Services Director here at Senior Connections, and I've been with the agency for 35 plus years. Also, we have a rich history of collaboration with other groups toward maximizing resources for older adults, caregivers, and their family. One of these collaborations is the state-directed No Wrong Door initiative with over 100,000 regional community records and over 30 community partners. The latest technology we have is Direct Connect, which is where we're partnering with Virginia Navigator to allow seniors and their caregivers to seek resources and possibly connect to those resources via the No Wrong Door system, and connect with services such as our Ride Connection program, where we serve seniors with affordable, accessible rides to meet their individual needs.
I'm Charles Barker. I've been involved with Senior Connections for the past 18 years. I'm presently serving as the Vice Chair of the Advisory Board. Senior Connections is considered a go-to agency. They empower others and they serve several diverse groups within the community. There are so many families today in our community that cannot use some of the services at the local posts around our Tri-Cities. Lives are changed because we meet immediate needs such as activities, food, transportation, and other resources. So Senior Connections has grown, in my opinion, massively.
Greetings, I'm Michelle Johnson, Chair of the Board of Directors for Senior Connections. Senior Connections is a part of an extensive network of DARS, the Virginia Department of Aging and Rehabilitative Services. DARS provides a tremendous amount of funding to Senior Connections, but they're excited to see the community support that the agency is able to leverage from community supporters just like you and I. This year, we are pleased to announce that Senior Connection is receiving significant recognition for our Rides Care program, as well as the Leadership Program or the Longevity Project, formerly known as Age Wave.
As an umbrella organization with more than 150 community partners, we serve over 24,000 adults and caregivers each year. Through our 30 unique programs, we provide critical services and information about available resources, all based on individual needs. Over the past 5 decades, we've created a profound impact on the greater Richmond community, growing along the way.
Nagle, Bolio, and it is my privilege to be here today to assist with the presentation of the Humanitarian Award in the name of Frank and Phoebe Hall. In 2013, this award was established to recognize the contributions made by caregivers and others to those who are older in our community. It is my privilege to have known the Halls for many years. Actually, I knew them before he went into the House of Delegates. It also has been my privilege to recognize how much they care, particularly for the older citizens in our community, and how much he would like to do for them.
Thank you, Nancy. I'm Eva Teague Hardy, and I've been working with Thelma Watson for many, many years on this particular program. And I want to thank her for always including me and bringing so many people together to help others. We are very lucky to have Phoebe and Frank as our models for what this award should be like. This award exemplifies all the qualities that Phoebe and Frank had in their extensive careers of public service. Nancy and I are pleased to recognize 3 individuals providing both service and advocacy. The first recipient is Dr. Ellen Netting. The second is Lynn Seward. And the third is Mrs. Marilyn Branch-Mitchell. I congratulate, along with Nancy, all 3 of these remarkable women who have done so much for our community, and congratulations on your award.
My name is Ellen Netting, and I am honored to be one of 3 recipients of the Phoebe and Frank Humanitarian Award. I see the future and the quality of life of older adults as being something that we have to focus on in terms of meaningful and empathic relationships. Often we are isolated from one another, or there are barriers that occur in our relationships. It is important to find ways and new approaches that we can remain connected across all age groups so that we have the ability to support and care for one another. And I see a future that has those meaningful relationships as the basis of what we need to be doing. Senior Connections is positioned to be able to provide those types of meaningful relationships and connections, and I know that they will be continuing to do that in the future. That is why I am honored to receive this humanitarian award, because Senior Connections believed in me. And it means the world to me to know that someone thought that I might have made a difference in anyone's life, because isn't that what it's all about?
I'm Lynn Keidel Seward, and I'm deeply honored to be one of 3 recipients of the Frank and Phoebe Hall Humanitarian Award. I believe the success of Senior Connections all these years has been the committed and dedicated staff and the exemplary leadership of the Executive Director, Thelma Bland Watson. Through Dr. Watson's leadership, the agency has become a major driver in system change and service delivery. Dr. Watson has developed multiple partnerships within the community, including corporate and the government sector, which is really propelling the agency to meet the future head-on.
Hi, I'm Marilyn Branch-Mitchell. I'm the Human Resources Director here at Senior Connections, and I've been here for almost 20 years now. I was very fortunate that I had an opportunity to know both Frank and Phoebe Hall, and I hope that I have been able to reflect just a fraction of the kind of care and concern that both of them exhibited in our community. Senior Connections has been very fortunate to have such forward-thinking leaders like Dr. Watson and Mary Payne, who have always been on the forefront of the issues that are facing our seniors. I've been very inspired by the way that Senior Connections has been able to adapt and pivot to the rapidly changing needs of our older adults. We've been very successful at finding creative solutions and ways to address the needs of our seniors and our staff. I'm confident that Senior Connections will be able to be flexible and continue to meet the changing needs of our seniors.
Hello, I'm Virginia Governor Ralph Northam. It's great to join you virtually today in support of the 17th annual Empty Plate campaign and to celebrate the important work of Senior Connections that began almost 50 years ago in 1973. COVID-19 continues to have adverse impacts on older adults in our Commonwealth and across our country, and many of the community partners represented here are on the front lines of our efforts to keep Virginians safe and healthy during this pandemic. Chief among these groups are the area agencies on aging throughout Virginia, including Senior Connections in Richmond. And Virginia's Department of Aging and Rehabilitative Services also does a great deal of work to help support senior citizens along with our area agencies on aging. Senior Connections has served older Virginians for nearly 50 years, and this unprecedented health crisis is no different. Now more than ever, it is so important that older adults can safely access vital needs and services like meals, medication, personal care, home repairs, and transportation. But Senior Connections is also working to keep our seniors connected, engaged, and healthy. All of these supports help to prevent isolation, link older adults and caregivers with resources in their communities, and empower individuals to age with dignity and choice. This is a crucial time in our history for supporting the needs of older adults and caregivers. Today, older adults are healthier and they are living longer than they were 50 years ago. This has put unprecedented pressure on the institutions and organizations that serve older adults, and it has highlighted the importance of community support to meet their growing needs. And that's exactly why the Empty Plate campaign is so critical. Proceeds not only help to fill empty plates, They also enable Senior Connections to fill in the gaps for our seniors so they can live fulfilling lives. On behalf of the Commonwealth, congratulations on this milestone anniversary, and thank you for your continued commitment to enhancing the quality of life for older adults and individuals with disabilities and their families.